So what I want to talk to you about today is why I think a focus on health is key to political renewal. But before I can do that, I have a bit of a confession to make. I'm not just a family doctor, I'm also a former politician, which makes it very gratifying to see an X beside my name. And I may be a future politician, and I say that with some confessional tone, with some trepidation, because really, that's something that when I first started telling people that I was going to get involved in electoral politics, the first response that I got was, what would you want to go and do a thing like that for? And that's a fair question, because when you go from being a family doctor, on the professional trust-o-meter, you're way up here, just below firemen and pharmacists. And then, politician at the very bottom of the trusted professions. So what would you want to do a thing like that for is a very good question. But it made me ask another question. Why is it that politicians are so distrusted? And it's not that hard to come up with some pretty clear answers. We've all seen evidence of politicians who have lied, have been engaged in corruption, have worked for the benefit of those who paid for their campaigns more than those who voted for them, who've run on one thing and done another. We've seen them act childishly, juvenile behavior in our most hallowed halls, ways that we'd never want to hold up as role models to our children. We also see a media that's focused on scandal and celebrity as though these were Hollywood actors or professional athletes, and instead of focusing on the key issues, they're focusing on the sensational aspect. But more importantly, it seems like there's just a lack of a focus overall, a lack of a common goal. It seems like they're just not doing what they're supposed to be doing, which begs a second question. What should they be doing? And to my mind, that's two things. One, they should be doing what's good for us, actively working to improve the lives of those who live in the society that they're representing. And two, doing what we want, engaging in democracy, involving citizens, and making the decisions to improve that society. And there's a reason that I think the common goal we're looking for and the missing piece in getting us back to doing what we're supposed to be doing is health. For one, it's what is good for us. If we look at the World Health Organization definition of health, it's not just the absence of disease, but it's full social, physical, and mental well-being. That seems to me like a pretty good shorthand for what we want as a society. It's also what we want. Our language is peppered with references to health. If someone's expecting a child, they'll be asked, is it going to be a boy or a girl? And the cliched and correct answer is, who cares, as long as it's healthy. We talk about healthy debate, about healthy appetites, healthy relationships. When we celebrate, we toast to each other's health. It also plays out in politics, where in polling of public opinion, always near or at the #1 issue of public concern is healthcare. And that's important to dig into a little bit as well. Healthcare is a surrogate for the importance that health plays in our life, but it's also not health. Healthcare is what I do. It's what we do in the health professions when we've failed to keep people healthy. It's in reaction to not having addressed things in a proper way. So for a political renewal to have health at the forefront, we need to reconsider and move beyond the idea of health as healthcare. And this is where folks in public health often talk about this idea of the river. Imagine you're standing on the edge of the river and you see a kid floating down, spouting and sputtering and about to drown. Brave soul that you are, you tear off your runners, you dive in the water, you grab the kid and you swim to shore. Pat yourself on the back as a hero. But then along comes another kid. And you have to do the same thing, drag another kid to shore, and then another kid, and another kid, and you're calling out to everyone in town, come to the shore of the river, get brigades pulling kids out of the water. Eventually, hopefully, somebody's going to be clever and say, who keeps chucking the kids in the water? And they're going to walk upstream, and they're going to find out and see what they can do about it. So, and slide please now. Thank you very much. It's my only slide, so they didn't give me a remote. This list is who's chucking the kids in the river. This is a Canadian list of the social determinants of health. Income, education, employment, food security, housing. These are things we know about, and the list can even seem a bit obvious. And I find it helpful to envision the story of one of my patients to illustrate this. Someone I've been thinking about a lot lately is a young woman named Kathy. She's a couple years younger than I am. Kathy has some infections in her legs, and those sores that have become infected aren't getting better because Kathy also has HIV, so she's not very good at fighting infections. And as a result, the infection has even gotten into the bone, and she's at risk of losing a foot or a leg or even her life. Now, we know what to do to treat those infections and to treat her HIV, but that's really, really hard with Kathy because, to be honest, Kathy isn't sick with HIV. She isn't sick with infected legs. She's sick with poverty. She's sick with generations of marginalization of her family and the abuse that has come down to her through that process. She's sick with a truncated education and becoming a mom too young. She's sick with poor nutrition and not a good place to live and really serious addictions. And so any approach that is trying to address the health issues that she's facing needs to be looking at this list, not just looking at trying to get her the right pills or get her into the hospital. This is what's chucking the kids in the river. And I think it's really important for us, if we're going to be looking at improving the health of society, to be focusing on this. One, because there's science behind it. We know this is what really is making the difference in people's health. Two, we can measure it. We can see whether or not when we're addressing this, we're being successful because we measure health outcomes regularly. And because human health is really the canary in the coal mine of our health as a society overall. And what this offers us is an opportunity to move to something I call evidence-based policy, where currently what we do is largely based on anecdote, past practices, best guesses, and what seems to be popular in the polls. But what we really need to be able to do to address the core problems of society is to assess them properly, dig into what's been done here and in other places and find out what really works, and then once we implement something, investigate that and own whether or not we've been successful and change accordingly to have the policy that has the greatest impact on people's lives. One of the key pieces of evidence to make that shift comes from researchers like Richard Wilkinson out of the UK and others who've been talking about the importance of equality for health. What they've discovered is that in states and countries where there are greater gaps between the wealthy and the poor, health outcomes are worse. Now that doesn't seem like a real news flash to anyone. If you have more poor people are sicker, there's going to be worse health outcomes. But what's really interesting is it's not just the poor people who are sicker, it's the wealthy in those unequal societies. If you're a wealthy person in an unequal society, your health is actually worse than if you're at the same level in a society that's more equal. And that to me is really interesting. There's something about a level of poverty and privation. There's something in crime and lack of safety. There's something about the stress of competition that makes lives less healthy for everyone in a society that's less equal. So if we're going to improve health and improve health for everyone, we need to make a more equal society. To make a more equal society, you have to focus on the determinants of health. They're so intricately intertwined to be basically the same thing. Now, a lot of people don't need this kind of evidence. It's fairly straightforward. We should take the stories of people like Kathy and want to make a difference in their lives. We shouldn't be okay with letting things stay the way that they are. We should work with her to make sure she's got a stable income and doesn't have to be working the streets, so that she's got the social supports to help her with her addictions, so that she's got a safe place to live. That's pretty natural. And yet there's still a lot of resistance to ideas around improving equality and addressing determinants of health. People say it's unfeasible. And I think more than anything, there's just a sense that it's working against their own perceived self-interests. And that's why this piece of evidence around equality and the importance equality has for all of our health, not just the health of those at the bottom of the socioeconomic scale, is really important for reframing the discussion. These are changes that will make life better for everyone. And it's worth digging into concepts around economy. If you think about addressing these issues, you can think about how it improves the economy. You have more people who are able to participate in markets, more people are able to be employed and increase productivity, and ultimately you wind up with more tax revenue and more ability to take further steps to improve the lives and address the determinants of health where it needs to happen. So that's really exciting to me, because what you've got there is one of these rare opportunities where strategy meets philosophy, where the right thing to do is also very clearly the smart thing to do. If we're addressing inequality, we improve the health of everybody in society. If we do so using the determinants of health and using health outcomes as the goal, we also have a means that's effective, a means that's measurable, and a means that's palatable, because people care about health. We've talked about how important that is in all of our lives. It's something we all desire for ourselves and our families. And that gives us an opportunity to do something really important and really necessary, which is have a new focus to try and reorder what is an increasingly dysfunctional political system. And this is where my mind starts to wander a little bit. I start to imagine, what if we had a party, for example, that in opposition, every time it was quizzing the government about their decisions, was using this list, was saying, what are you going to do about health services, about food insecurity, about housing? How are you going to improve health outcomes? What if, in a platform, they actually outlined their plan based on the determinants of health and the things that are going to have the most impact? What if we had a media that was trained on this question, and every time they were grilling any of the parties, they were asking, how is your plan going to actually make our lives better? How are we actually going to get healthier because of what you're saying you'll do? And what if in government, you had a government that was honest and said, here's what we do, here's what we've been trying to do to improve health outcomes, here's where it's succeeded, and here's where it's failed and where we plan to do differently. And what if you had a public that was aware enough of this to be demanding for exactly that kind of language? Maybe you'd get to a situation where the next time somebody says they wanted to enter politics, rather than what the hell you want to do that for, they'd hear, way to go, way to represent. More importantly, maybe stories like Kathy's, as we're addressing the determinants of health and creating a really healthy society, maybe those stories would be far more rare. Thank you very much.